St. Mary police arrest over 20 people and destroyed Ganja field during targeted operation in Anota Bay on Monday. The St. Mary police arrested 22 people and destroyed a Ganja field during a targeted operation in Anota Bay on Monday. 3 of those arrested were charged with various offenses, while the remaining 19 were processed as the investigation into organized crime continued. About 1,000 marijuana plants found at a cultivation site in Crooked River District were destroyed. Head of the St. Mary Police Superintendent Anthony Wallace said the operation reaffirms the unwavering commitment of his team to dismantle criminal network and enhance public safety.
We executed a major pre-dawn operation across several areas in St. Mary, targeting known criminals with support from the Jamaica Defence Force and our specialized law enforcement units across the JCF. One of the most significant outcomes was the discovery and destruction of a large ganja field in Crooked River and Anota Bay. Over 1,000 mature plants and seedlings were eradicated, dealing a serious blow to the illegal drug trade. 3 individuals were arrested for various offenses, and several others were detained as investigations continue. This is part of our ongoing strategy to dismantle criminal networks and restore order. We remain firm in our commitment to making St. Mary the safest parish in Jamaica.
Over 2,000 teachers granted leave at a cost of $7.87 billion, stated the ministry. The Ministry of Education has approved leave for 2,026 teachers for the 2025-2026 academic year at a total cost of $7.87 billion. The figure includes payment for temporary replacement and direct leave entitlement, the ministry confirmed in a statement issued Wednesday. The approvals were granted for a total of 2,860 applications submitted. According to the ministry, the leave approvals spanned 4 key categories: 4 months vacation leave, 834 teachers; 8-month vacation leave, 907 teachers; study leave, 71 teachers; and leave prior to retirement, 123 teachers. Special measure, 91 teachers receive approval for an 8 months vacation leave, despite surpassing the statutory 10% cap. This exception was made to facilitate all teachers who are at the maximum of their leave entitlement, and denial would have negatively affected future entitlement had they not proceed on a leave after this academic year, the ministry explained. In addition to the teachers' leave approval, 6 non-academic staff across 3 regions were granted study leave at an estimated cost of $17.7 million. Permanent Secretary Dr. Jobe said ministry was able to fulfill its statutory obligations under the Education Regulations 1980 thanks to budgetary provision approved by the government. We applaud the work of the governing school boards and principals who facilitated the initiative reviews and recommendations for further deliberation at the ministry level, Dr. Thorpe noted. She acknowledged that despite the substantial allocation, not all applications could be approved within the statutory limit. Teachers whose leave applications were not approved may appeal through the ministry's administrative channel, with cases reviewed individually and subject to budgetary constraints. This annual leave process, guided by national education policy, is part of the ministry's effort to maintain a balanced approach to teacher welfare and stable school operations. Health warning. The Planning Institute of Jamaica (PIOJ) is reporting that just over 25% of Jamaicans are living with at least one non-communicable diseases (NCD). The figure is reported in the 2024 Economic and Social Survey Jamaica released recently by PIOJ. According to the ESSG, the 3 most reported NCDs in Jamaica in 2024 were hypertension, asthma, and diabetes. Comorbidities having more than one NCD was reported in 9.2% of individuals and was most prevalent among the elderly, 38.9% the survey found. An NCD is a long-term health condition that may require ongoing medical attention or management. These conditions are often categorized by persistent effects and can significantly impact a person's quality of life. NCDs significantly strain Jamaica's economy and household. From 2015 to 2030, they are projected to cost the country US $18.45 billion, about US $6,306 per capita. Minister of Health and Wellness Dr. Christopher Tufton has reportedly pointed to the problems that country faces with NCDs, which in many cases are brought on by lifestyle choices. According to Tufton, his ministry is working collaboratively with community and private sector stakeholders through its flagship You Know Your Number program to make inroad with the health screening of Jamaicans. At the end of April this year, under the Know Your Number program, 289,430 tests have been conducted and approximately 72,357 persons have been screened. Tufton told Parliament during his contribution to the 2025-2026 sectoral debate on June 10. On the number of tests conducted, 103,817 were for blood pressure, 82,682 for blood cholesterol, 35,178 for cholesterol, and 67,573 for body mass index. It is instructive to note that from the 289,430 tests conducted, 105,228 or 36% reported abnormal test results, stated Tufton. Know Your Numbers is a national initiative aimed at empowering Jamaicans to take control of their health by monitoring risk key factors from NCDs and to do the necessary health check including blood pressure, blood sugar, cholesterol, and body mass index in order to get and remain in the Know Your Number health. The initiative was first announced by Tufton during his sectoral presentation in May 2023. According to Tufton, this year the Health Ministry will continue screening island-wide as part of its primary health care reform, which champions routine screen and delivery of health education messages according to life stage and every doctor's visit. This way we integrate Know Your Numbers into the health center, thereby enabling the increase in the health literacy of the population for better decision making. The government has prioritized screening and will continue to expand under our new life stage approach, Tufton noted. In the meantime, the 2024 ESSJ noted that the health status of a population is determined by a combination of health indicators, epidemiological data, and social determinants of health. This is a vital tool for nation building as it directly informs policy decisions and influences resources allocation, the ESSG noted. According to the survey, life expectancy at birth in 2024 was estimated at 74.2 years compared with 72.7 years in 2011 and 72.0 years in 2001. It found that the country recorded a crude birth rate of 9.6 per 1,000 of the population and crude death rate of 7.6 per 1,000 in 2024. The ESSG also highlighted that Jamaica's birth rate remains flat last year. Preliminary data from the Registrar General Department showed that the total number of live births were 25,900 compared with 29,400 in 2023, it stated. The Southeast Regional Health Authority recorded the largest number of live births with 11,400. All regions recorded decline relative to 2023. Meanwhile, the total number of deaths were 20,600 compared with 21,900 in 2023. There were 237 neonatal deaths recorded last year, 75 fewer than the total number recorded in 2023. Sarah recorded the largest number of 141. In 2024, approximately 5.0% of individuals surveyed reported illness injury during a 4-week reference period with an average duration of 8.8 days. An estimated 76.6% of those who reported illness injury reported seeking care. To subscribe, like, share, and click the notification bell for daily updates.